Pandemic has been the watershed event of our time. We talk of the pandemic in terms of what life was like before COVID and what it was like after, or what it is like after. But today's discussion is part of that idea. What are we doing to recover, really, after the pandemic? Everything was affected: schools, school children, teachers, businesses. Our daily lives came to a standstill. In that moment, we were all affected. Y'all know, as Chair of Public Safety, I guided our committee through the mental health allocations, which was $26 million. I think the biggest pot of money. So it was, and every dollar, every single one of those dollars means something. I'll be the first to say that $26 million for mental health is nowhere near enough for our community, especially now, but it's a good start. The plan prioritizes, this plan I think prioritizes children, youth, seniors, and those with special needs, which are all populations that are very dear to my heart, especially those with special needs. It considers the effect of isolation and the trauma that many of our family and friends and neighbors felt when our lives were suddenly altered. The Public Safety Committee decided to lean on the nonprofit community in this work. Nonprofits are on the front lines of mental health care every day, and they're best equipped to lead our response. The number of applications received from organizations that provide mental health care was overwhelming and showed how much help was actually needed. And we probably didn't even hear from half of the organizations that are out there doing that work. I have consistently voiced concern for the most vulnerable, for foster youth aging out of the system, veterans, I mentioned our special needs community, and our first responders. Access to mental health services and continuing to shine a light on the stigma of mental health is vital. Some of you know I'm a disability attorney by trade. That's my other job. And I take my clients who have comorbidities, but a lot of times they have a mental health impairment. And I'm sorry to say that the system just doesn't acknowledge them. So the work that we've done, my silver lining of the pandemic is that we're all talking about mental health. And so focusing on mental health in this Public Safety Committee and with these ARPA dollars is a way to kind of put our money where our mouth is. And so I thank everybody for applying, and I'm grateful we're able to help at least some mental health care operators out there. I do have a couple of questions. Does the ARPA money, can we use the funds for capital projects that will eventually go on to support mental health initiatives? I'm not sure who I'm asking.
Councilwoman, the short answer to your question is yes. Okay. However, on this RFP, what we follow were the priorities of the City Council that were approved within the implementation plans, and capital construction was not one of those categories approved by the Council.
Okay, thank you. Of the proposed groups receiving funding, can you tell me how many are helping foster youth?
So I'm going to rely on Jessica a little bit, okay. So because we have some in the nonprofit section. In the mental health section, we have one that's in youth mental health that's providing therapy to youth in foster care. And then we have two that's in that homelessness line item that's providing homelessness prevention services and mental health. Okay. In youth services, we have, it's three that are providing supportive services for higher education and workforce training.
Okay.
So I guess that's 6 total.
Okay, that's great. I'm glad to support those. I think that's one of our most vulnerable populations, are foster children, especially that are aging out of the system. Can you expand to me on the recommendation for reissuance of the RFP? I think it was, is it 2.4? Am I getting that right?
Yes, that's right.
That's focused on what exactly?
We're going to refocus that on youth aging out of foster care.
Okay,
and we'll do it through a competitive bid. We decided not to do it through consolidated funding so that we could do it earlier in the year and get the money out sooner.
Okay. I hope we continue along that recommendation. I feel very strongly about this population. Met a lot of good people that are doing good work out there. And I think reissuance of that RFP for that amount of money going towards foster youth aging out of the system is very important. I know that there's been talk about maybe moving that 2.4 to some other area, to benefit some other organization. And what I'll say to that is I think that's partly why this population keeps getting kicked down the road. Mm-hmm. There's always something more important than them. And so I want to show them, and I think, I know this council has been very supportive of foster youth. that we are, again, putting our money where our mouth is, and we're not going to push them to the side in favor of a different type of organization. So I appreciate your thoughts. I do want to talk a little more about maybe what we can do to help capital projects, but I'll wait. Thank you. Thank you, Mayor.